Welcome to the Life After ECT podcast. My name is Anna. I'm an ECT survivor, and I'm also the founder and director of Life After ECT Incorporated, the first nonprofit dedicated to improving the lives of those harmed by electroconvulsive therapy through advocacy, education, and research. You can learn more about what we do by visiting lifeafterect.org. In today's episode, I'll be reading a 2010 letter to the FDA from Linda Andre, author of, in my opinion, one of the most important books on ECT, Doctors of Deception, What They Don't Want You to Know About Shock Treatment. This letter shares reports from people who had permanent memory and cognitive problems after ECT. Reports that were sent to Dr. Harold Sackeim, a leading government-funded ECT researcher. According to Andre, he publicly claimed he'd never seen cases of permanent memory loss and offered to evaluate patients, but when patients reached out, he ignored them. I'll also be reading those emails, which highlight patient neglect and denial of known side effects that's basically been going on for as long as this procedure's been in use. I find this history really important for understanding how we got here and what the real controversies with ECT actually are. I also think it's important to honor the stories of those harmed by ECT who have been abandoned by the medical system. I'll start by reading Linda's letter, and then I'll follow up with reading the emails. To the FDA, supplementing my previous submission, I enclose information previously unavailable to you regarding the permanent adverse cognitive effects of the ECT electroconvulsive therapy device. The information is relevant to the question before you, which is whether ECT has been sufficiently researched and proven safe, or whether further scientific investigation, including clinical safety trials, are needed. These are reports from people who had ECT in recent years and experienced permanent deficits in memory ability and other cognitive abilities, known as anterior grade amnesia. They were forwarded to me after being sent to Dr. Harold Sackeim of New York State Psychiatric Institute, the nation's most prominent ECT researcher and, for the last 25 years, the principal investigator of an ongoing NIM grant to study ECT's cognitive effects. Dr. Sackeim had claimed that he had never seen a case of permanent anterior grade amnesia and publicly offered to evaluate former patients who had experienced it. As documented in my book, Doctors of Deception, What They Don't Want You to Know About Shock Treatment, at least 195 such patients contacted Dr. Sackeim, consistently reporting the same serious adverse effects. Dr. Sackeim later testified that he had thrown away all communications from these patients and did not conduct any evaluations. How are the adverse cognitive effects of ECT ever able to be fully investigated when the principal investigator of a NIM grant on this topic refuses to investigate, even after publicly pledging to do so? There must be full clinical trials using controls, relevant instruments, and adequate follow-up time of ECT's permanent effects on memory and non-memory cognitive abilities. The ECT device must be maintained in Class 3, and the manufacturers must be required to submit pre-market approval applications. Linda Andre. The first email. I am 29 years old and live in Miami. In 2000, I had ECT treatments done 12 times. In March, I had 7 treatments, and in June, I had 5 more. In March, after having the 5 treatments, I had 2 seizures while out of the country. In July, I again had a seizure. Before having ECT, I had never experienced this problem. Also, I have trouble with my memory since having ECT. I cannot remember things that happened between 1 and 1.5 years before the ECT and about 6 months afterwards. After having the ECT treatments, I had a lot of trouble retaining new information or remembering how to get to the store around the corner. I also had trouble with my speech. I would have trouble finding words, and I would stutter a lot. Most of the problems have resolved, I feel like there have been some negative effects that are permanent, which I will have to live with. I am a nurse and working now, currently taking medications to control the depression. I would like to help out with any research on this subject. Also, I would like to receive any information you might have. Thank you. Second email. Dear Dr. Sackeim, I'm a bipolar 2 patient of Dr. Gregory Sullivan at WellSpan Behavioral Health Clinic in York, Pennsylvania. I have had dozens of ECT treatments to stem episodes of major depression and for quote-unquote maintenance afterwards to prevent relapse. I also cannot remember major periods of time in my life, get lost in my hometown of 44 years, cannot concentrate, have short-term memory problems, and will probably never be able to work again, not because of being bipolar, but from the destructive effects of my quote-unquote necessary ECT treatments. I understand that you were looking for people for a study to assess this type of damage due to ECT. I would appreciate being included. Email number 3. I believe I have permanent memory and cognitive damage from 15 to 20 ECT treatments over the course of 3 years. If you would like for me to participate in an ECT evaluation, you may contact me by email or at the address below. Next email. I did have ECT treatments 14 years ago, and I do suffer from short-term memory loss as well as big gaps in my long-term memory. The doctors told me that I would either get my memory back in a short time or I would never remember events leading up to the ECT. Well, he said nothing about it affecting my short-term memory. It's been such a struggle. I have felt like a zombie the past 14 years since the procedure. I feel like it has given me brain damage, and I can't even hold a job because of my memory, and I can't take much stress either. ECT did save my life, because without it I wouldn't be here today, but I have long-term effects from it. I'd really like to be included in your study. Email 5. Dear Dr. Sackeim, I came across an article describing your May 18 invitation to evaluate anyone in the country who has had brain damage from ECT. In addition to a subjective sense of damaged ability to form new memories, since I never had prior testing to ECT, I don't know how you'd ever evaluate this. I have had permanent long-term memory loss. I have lost most quote-unquote event memory over my entire life. That is, I remember skills, people, facts, etc., but I have no memory of events that have taken place in my life. Childhood activities, marriage, the birth of my children, raising them, are permanently gone. It's been about 2 years since my ECT. I spent an entire month with my 3 sisters caring for my mother while she died of cancer. I have 0 memories of this time. Again, not having prior to ECT testing, I don't know what kind of testing you could offer to document this finding. However, I'm interested in hearing what you have to say. The article suggests that you don't believe ECT causes brain damage, so I'm not sure why you'd want to interview me. If you found a way to document the brain damage I have, you'd have to retract your statements. The vast majority of other ECT patients I've talked to, dozens, my doctor is the head of ECT at Baltimore Hospital, complain of some level of permanent memory damage, a few as severe as mine. If all her patients have memory loss, either she's doing something terribly wrong, or you are. The bottom line is, if ECT doesn't cause brain damage, why can't I remember my life? I'm not currently depressed. I'm not currently on any medication, and my memory has been gone since some time during ECT treatment. Does an adequate evaluation of memory loss secondary to ECT actually exist? If you can convince me that you're capable of providing an evaluation that actually measures something, I will be happy to accept your invitation and provide you with an interview. Next email. Dear Dr. Sackeim, I am absolutely certain that I suffer from permanent memory loss caused from the ECT treatment that I have been having. I can say without a doubt that it has had an effect on my cognition, and this is causing me a tremendous amount of distress. I was only told that the ECT would have a temporary effect on my memory, I have since discontinued my ECT treatments 2 weeks ago because it was not doing enough for my depression to put up the cognitive problems it's causing me. Now, 2 weeks later, my memory loss is no better, and it is a terrible feeling. So, I am responding to your request to evaluate people who have had adverse cognitive effects and memory loss because definitely me. Please email me with more information about getting an evaluation. Next email. To whom it may concern, I am a survivor of ECT treatments. I had them for 6.5 years, every 3 weeks for most of that time. At times I had them every week, every 2 weeks, every 4 weeks. The treatments were the bilateral type. I still have major chunks of my memory missing, and I still struggle with the same issues that ECT was supposed to help. I was in the upper 90% of IQ level, but I rather doubt that I am now. If there are ways to get my memory back, I would like to try them. At the same time I was getting the ECT, I was on as many as 20 psychotropic drugs at a time, ranging from antidepressants, tranquilizers, sedatives, sleeping medication, lithium, antipsychotics, etc. When I was given the ECT treatments, I had no idea that they were still doing or what the potential side effects would be. I didn't even know why they were doing it. I still do not understand at all as to what happens to the body during ECT, but I'm starting to have flashbacks of experiences. Next email. I noted with interest the notation in ECT.org site that there is an interest in patients with cognitive losses which are post-ECT. I have severe memory impairment. My doctor seems to minimize this. I worry about it, have delayed making any inquiries until watching recent television program, I believe on Discovery Channel, regarding ECT. In addition, I have at times felt I was the only one who has this permanent loss of memory, especially long-term. I was embarrassed to discuss it. In any event, is there a study? Are there resources to discuss, theorize this issue via your group or with resources of your grant? Thank you. Next email. Dr. Sackeim, I believe you have been on record for making the following statement. I invite anyone in the country who believes ECTs had a deleterious effect on their cognition to come to us for an evaluation. I received a series of 9 shock treatments in 1996 in McAllen, Texas, and I have significant chunks of memory loss associated with that therapy, which, by the way, seemed to have little effect on my depression. Years later, those chunks of my life are still missing, and I feel my memory seems not to be what it once was. I would like to determine if the treatments I received in Texas are responsible. I am a 39-year-old English teacher who still has problems with depression and seasonal depression, most symptoms of which are successfully treated with Celexa and imipramine, along with periodic counseling sessions. I don't have any money to speak of for travel or medical expenses, but I would really like to find out more about the effects these treatments have had upon me. If you are unable to arrange an evaluation yourself, I would very much appreciate your suggestions in that respect. Thank you for your time and consideration. Next email. I had ECT treatment about 8 years ago, and I don't have even close to the memory ability I had before. So let's get me out there so you can check me out and fix my memory. Next email. I received many ECT treatments. I was asked to sign permission for treatment when I was not mentally capable of making such a decision. I have lost most of my past. I have lost so much more than my past. I don't remember most of my children growing up. I don't remember even the house I was living in. I don't remember most of my childhood. I don't remember my friends, and I was too ashamed to tell them I didn't really know them. So gradually, the friends gave up on me. I'm still battling just as much with depression and suicidal thoughts. I didn't remember where I worked or even how to do my job. I can't argue with people's perception of the past because I have very little memory to have any basis of my own. and I don't know now what I remember or if it's what someone has told me. I had not battled with depression long enough to even see if therapy or medication would be successful. I'm now trying to put my life back together, but there's always that uncertainty of my knowledge and ability since it seems all new to me. Next email. I'm not sure if this is what I need to do, but I am a victim of ECT. I had 6, they say bipolar treatments, but I think they either mean bilateral or bitemporal. Anyway, they had 6 treatments in 1998 or 99 at the VA Center in Long Beach, California. I then received 6 treatments from St. Joseph's Hospital in Orange, California in 1999. These were supposed to be better because they were unilateral treatments. I have experienced loss of short-term memory that is so bad it feels like I have Alzheimer's disease. I have long-term holes too, like birthdays and other important information about my life and myself. I cannot function as a normal person anymore because I can't remember anything. My life is ruined. Next email. I understand that you are disputing the claim that ECT has had detrimental effects on patients. I'm a fairly articulate person who was depressed several years ago and thought that ECT was the answer as described by my doctors. After having 160 treatments over a period of 19 months, my memory was definitely affected. The ECT stopped in 1996, and my memory effectiveness has continued to decrease significantly since that time. More than just middle-aged lady aging, I might add. I have since had a heart attack and suffer from some mild forms of anxiety. I am a professional woman who has had to give up her own corporation of 20 years to work for much less part-time in tasks that are not so demanding that my memory loss would be noticeable to my clients. It is very disappointing to me to not be the woman I was capable of being as a result of the effects of this treatment. I challenge you to dispute the facts of my case and maintain that there is no long-term ill effects of the treatment. Next email. Dear Dr. Sackeim, since you said, quote, I invite anyone in the country who believes ECTs had a deleterious effect on their cognition to come to us for an evaluation, I would like to volunteer to be a part of your study. I believe I experience not only memory but cognitive effects from having ECT. I believe these changes are permanent, but since I am not dead yet, it may be a little hard to prove. Please contact me and inform me as to how I might participate. I admire your open-mindedness to be willing to study those of us who have had serious problems, whom practitioners of ECT would like to ignore or forget. I think it's at least equally important to document the adverse impacts of a medical procedure as the potentially positive ones. I hope you are open-minded enough to be able to do that too, in spite of your views as an advocate. Thank you for your consideration. Okay, I'm about a fourth of the way through the emails, so I'm going to call it quits for now and then continue reading them in a future episode. Thank you for tuning in to the Life After ECT podcast. If you'd like to learn more about what we do and how you can support our work, please visit lifeafterect.org. Thank you.